Is your heart getting enough oxygen or you are ignoring the warning signs? Let us study the ischemic heart disease in this video. What is ischemic heart disease? Ischemic heart disease occurs when myocardial oxygen demand exceeds supply, most commonly due to the coronary atherosclerosis. It means the heart is unable to get enough oxygen, which leads to the ischemic heart disease. The primary etiology for the ischemic heart disease is atherosclerosis. 90% of cases are due to the atherosclerosis. The coronary artery spasm, Prince metal angina, coronary embolism or vasculitis, severe aortic stenosis or hypertrophic cardiomyopathy. Let us learn a mnemonic for it. The mnemonic for it is ischemia. That is, I stands for imbalance of oxygen supply and demand of the oxygen. S is for stenosis. C is for coronary spasm. H is for hypertrophy. E is for embolism. M is for microvascular diseases. I is for inflammation and A is for atherosclerosis. Now let us learn the risk factors that identifies the triggers of the ischemic heart disease, which are non-modifiable, modifiable. Non-modifiable are the age, that is more than 45 in men and more than 55 in women. It is common in male sex and in the post-menopausal woman. The family history of premature coronary artery disease, genetic dyslipidemia. Now let us learn the modifiable risk factors, that is hypertension, dyslipidemia, diabetes, smoking, obesity, the lack of physical activity and the stress. Mnemonic for it is A, B, C, D, E. That is age, alcohol, B is for BP, BMI, blood sugar, C is for cigarettes, cholesterol, D for diet and diabetes, E for exercise, and estrogen deficiency. Now let us learn the pathophysiology causing the ischemic heart disease. The pathophysiology from atherosclerosis to ischemia is the endothelial injury occurs, which causes platelet formation. This platelet accumulates and forms the thrombosis there, causing the plaque. This plaque ruptures and causes the myocardial ischemia. Critical event in the acute coronary syndrome is plaque rupture, exposing lipid core to the blood and triggering platelet aggregation and thrombus formation. Stable plaques cause chronic angina. Vulnerable plaque causes ACS, that is acute coronary syndrome. Now let us learn the clinical manifestation. Classic presentation of ischemic heart disease is stable angina, unstable angina or MI. Stable angina where substernal chest pressure on exertion relieved by rest or nitroglycerin within 5 minutes. Unstable angina, which is new in onset, worsening on rest, no biomarker elevation. For MI, that is STEMI or NSTEMI, crushing chest pain occurs more than 20 minutes. Radiation to the jaw and the arm, diaphoresis and nausea is seen. Atypical presentations of ischemic heart disease are seen in women, elderly, diabetes, may be present with dyspnea, fatigue, epigastric pain, syncope, maintain high suspicion. Let us learn the diagnostic investigations for the ischemic heart disease, where we have the ECG, cardiac biomarkers, invasive angiography, echo and stress testing. On ECG, we will see for the ST segment elevation and depression of the ST segment for the STEMI and non-STEMI respectively. Cardiac biomarkers, where the troponin is a gold standard biomarker which rises in 3 to 6 hours and gets peak at 12 to 24 hours. Invasive angiography is a gold standard and echo and stress testing. Now let us learn the management of the ischemic heart disease. The pharmacological management of the ischemic heart disease, where we use the antiplatelet drug like aspirin, clopidogrel, where the aspirin has a dose of 75 to 325 mg per day. Anticoagulants like heparin, anti-ischemics where we use nitrates for the venodilation, beta blockers to reduce the heart rate, CCD that is calcium channel blocker for the vasodilation to reduce the oxygen demand. And in secondary prevention we use high intensity statins that is atorvastatin 80 mg, ACE or ARB, SGLT2 inhibitors in diabetic patients for long-term risk reduction. Now let us learn the revascularization which is done by PCI or CABG. PCI where it is preferred for the single vessel disease that is in STEMI. CABG left main disease, three vessel disease, diabetes with multivessel CAD. Hybrid approach can be done where LIMA LAD plus PCI can be performed. Mnemonic for it is CABG, that is choose after bypass guidelines, means left main, three vessels, diabetes and multivessel damage. PCI is percutaneous coronary invasion and CABG is coronary artery bypass graft. Complications of ischemic heart disease are arrhythmias, heart failure that is LV failure, diastolic dysfunction, cardiogenic shock, mechanical damage where papillary muscle ruptures causing acute MR or ventricular septal defects, pericarditis can occur. The takeaways and future directions of these videos will give you IHD is the supply-demand mismatch. Atherosclerosis is a dominant cause. Address risk factors early with the ABCD. In the framework, we have learned the mnemonic for it. Second is time is equal to muscle, where the rapid ECG plus troponin, then activate cath lab for the STEMI. Every minute of delay causes myocardial. Lead management, combined platelets, statins, beta blockers, revascularization tailored to the anatomy and risk. Precision cardiology, where we use the drugs and we treat the ischemic heart disease. Thanks for watching and hit the like button if you understood the topic and suggest me the next topic in the comment section.